take a look at this image and you'll see that my finger is right on the tip of that instrument. And the reason for that is it allows me to leverage my finger against the tissue as I'm trying to work that luxator into the space between the bone and the tooth root. So I've got a lot of control. And if I go too, there's no way that I can go too far with my finger adjacent to the tissue while I'm working that with the butt of my hand against the butt of that luxator. So it makes it very safe, not only for you, but also for the patient, so that you don't jam that luxator up into an orbit, which has happened on numerous occasions in dogs and cats. So it gives you a lot of control over the instrument as long as your finger is right up next to the end of it. The other thing that you need to keep in mind when we're extracting especially cat teeth is they're very prone to fracture when you remove them. They're very little roots as far as their diameter goes, and they can be pretty long in some cases, especially the incisors and that distal root on that first molar. So what we want to make sure that we do is very gently luxate, and then once we get to the point where we've got some mobility and we put the extraction forceps on that crown, it's more of a pull with a slight torque, just like it would be if you were removing a cork from a wine bottle. You don't want to jam that cork down in and keep turning it while you're trying to pull that cork out, or it's going to do just what this one has done in this picture. It's just going to crumble, just like the root's going to fracture. So it's more of a pull, very, very controlled pull with not a lot of force, with a little bit of rotational back and forth. And if you do that, you're still going to fracture some roots, but it's going to give you the advantage of fracturing a lot less than you would if you got in there and were really aggressive with it. When you're using a luxator with cats, what you're going to want to do is make sure that you put very little pressure on those tooth roots when you're trying to luxate them. In dogs, you can grab with all of your fingers in some cases and put a lot of pressure on those bigger roots like the canine and the first mandibular premolar, but in cats you can't do that. It's more of a 2 fingers pressure is about all you want to put on those when you're trying to luxate them. When you're trying to get purchase between the bone and the tooth root, it's okay to use a rocking motion back and forth with the luxator to try to force it in with controlled apical pressure. But once you get in and you've got good purchase between the bone and the tooth root, then you want to apply a constant force, not a rocking force on that tooth root. So you can rock it to wedge it in between, but once you get to that point, you want to just barely torque it, hold direct pressure on that for 15 seconds, and count it, because 15 seconds feels like 45 seconds sometimes. So you'll give up too quick, and then all of the work that you put in, which is probably about 7 or 8 seconds, is all for naught. So you want to make sure that you count, get used to how long that takes, and pretty much count every time. And while you're doing that, you're constantly putting a little more pressure as you feel that tooth move, or if you're watching it with your magnified surgical loops, you can see it move 1/10 of a millimeter. If you're watching it just with your normal vision, you're not going to be able to see that. So you can constantly put direct pressure, increasing pressure on that as you go, and eventually you'll get to the point where you'll usually get mobility even on the first attempt. And you go to the other side, whether you're mesial or distal, you go to either the mesial or distal side, do the same thing, and within several minutes you'll be able to remove that with your extraction forces. With your high-speed delivery system, you always want to have the pedal depressed all the way for that. You want it all the way down because you want that burr rotating at its maximum so that your water spray is at its maximum and it decreases the torque and the mechanical disadvantage that all the mechanism in that handpiece and the little turbine in the head of that handpiece have, and consequently your equipment will last a lot longer. You don't ever want to hear that zzz. That means you're putting too much pressure on the burr against the bone or too much pressure on the burr against the tooth, and or you don't have that pedal depressed all the way. That's very hard on the equipment, and it's not good for the patient either. That tissue is probably going to be burnt if that's what you're hearing. So you want to make sure that your pedals are depressed all the way and that you're literally painting the tissue away with the burr. You don't want to use infrequent strokes on the bone or the tooth. You want it to be very frequent, very quick, just like you're painting, quickly painting. So when you're sectioning a tooth, that's when you get a lot more resistance because the tooth is much denser than the bone is. So when you're sectioning that tooth, it's just really quick movements against that furcation to get the burr through the tooth without causing a lot of damage to your equipment and burning the tissue.